Good afternoon, everybody, and welcome to sunny Athlone, which is great. Welcome to the HRB's third biennial grant holders conference. And for those of you in the room who I'd say might number quite a number, who don't know me, my name is Darrin Morrissey. I'm the relatively new CEO with the organisation. I joined it just over 6 months ago. So I've really been looking forward to this conference today because it's given me a great opportunity to meet all of the HRB funded community, the family, so to speak. At a broader level, this conference is a really terrific opportunity for the diverse range of stakeholders and researchers that we have to come together once every 2 years. I think it's an opportunity for everybody to interact with each other. It's an opportunity maybe for people to learn from each other, but certainly I think to share ideas and stimulate new thinking. And that's the way we've designed the conference for today. But I think in many respects, most important of all, it's an opportunity for us as funders to interact with the researchers on the ground. And to that end, we've got numerous HRB staff who I'm sure a lot of you know in the room. I'm not going to embarrass anybody, and I'm not going to ask anybody to stand up. But what I would ask everybody to do would be, researchers, please reach out, find the HRB staff, and use the opportunity for asking questions, conversations, having maybe raising some issues or so on. I will specially single out one part of the HRB staff, however. So the individuals who handle our open research publishing platform, Aileen Sheehy, who's in the room, I think, and Vicky Helen from F1000 Publishing. So they have set up a booth outside the door, and you'll have seen that on the way in. You probably will have seen the birthday cake. So this year we're celebrating the first birthday of the HRB Open Access, Open Publishing Platform. It's something that we're very proud of, and I just really would encourage everybody to go and get some birthday cake. I saw some nice takeaway cups as well out there, so please visit that stand. And before I go any further, usual housekeeping stuff. I actually never asked where the exits were, so green signs I think over there. Keep an eye on those exits if there's any emergencies. Toilet facilities out there, you saw them on the way in. And coffee and tea is on tap constantly throughout the day. So we're not doing a kind of a traditional coffee break. There'll be refreshments over there. And as well as that, in that corner of the room, we've put in place a photo booth for people to, over the course of the 2 days, please go and get your photos taken if you want. The rationale and the reason for that is, if there's ever some excellent research you guys are doing that gets press released, we often look for a head and shoulders shot, and having it on file is really helpful. And of course, you'll get a copy yourself as well. So avail of that facility there. So moving on, I mean, this year in particular, the HRB is feeling a great sense of opportunity about this conference. And I think it's because there's an awful lot of things happening in the system, in the health system and health research system. And it's very easy when you read the headlines and you hear about the difficulties in the health system. It's easy and understandable to feel a little bit downhearted and a little bit, I suppose, jaundiced and a bit tired of it all. But here in the room, I think the public rarely hear about the best parts of the health system. And I genuinely believe that today there's more opportunities than ever to drive positive change in the health system and in healthcare using the capabilities of health and social care researchers in Ireland. And I believe there's reasons, in fact, to be positive. So for me, there's some green shoots we need to be thinking about and reflecting on. For the first time in Ireland's history, you have a cross-party political consensus on where the health system is going. I appreciate it probably isn't fully funded yet, there's those tough conversations to have, but the Sláinte Care strategy and implementation plan is a really important piece of policy. And tomorrow we're going to have Laura McGahey here, and Laura will speak in depth, I'm sure, about Sláinte Care. The plan, in essence, is about shifting the emphasis from the delivery of care in the acute hospital setting only, and organising your system around that, towards something that's a bit more balanced and increasing the delivery of healthcare and public health interventions in the community. So underpinning Sláinte Care, again, in the next few months, as I understand, there will be announcements around regional integrated delivery organisations, integrating hospitals and community systems together. And within Sláinte Care, I think for us as a community, I think it's really important to know that there is an ambition to have a national R&D strategy for health, a new one developed over the coming years. And the first step in that is early in 2019, there will be an assembly set up by the Department of Health, which will be an R&D forum, which will be an early move towards that new strategy. So Sláintecare is there and it's relevant to the R&D community. Aligned with Sláintecare, the HSE, for the first time, is starting to put in place an R&D structure. It's developing its own R&D strategy, and it's building up resources with the appointment of an R&D director, Dr. Anna Teres, in the last 12 months or so. Now, this HSE R&D division, it certainly has its work cut out for it, and there's no doubt, and we have to acknowledge that as a monumental task ahead. However, in 2019, already it's going to be focusing on it. It started to focus on research governance systems within the HSE. And it's also talking about putting in place actual support infrastructure on the ground as well. So that's a green shoot, and that's one that will develop in the months and years ahead. And at the same time as Sláintecare and the HSE R&D division, the Department of Health are starting to, I suppose, grasp the nettles, the historical nettles, so to speak, and go after some of the systemic issues that we've had in health research in Ireland for many years. So with the introduction of European GDPR legislation last year, the health research regulations have been enacted in the last few months. And although I know there have been, and I know there will continue to be teething problems, I can probably hear some teeth grinding in the audience perhaps. There will be teething problems, but I genuinely believe that these regulations, the Consent Declaration Committee, the infrastructure that sits behind that committee, which, as you know, will be housed and is housed in the HRB, it's going to, in the long run, be an enabler of high-quality health research, not a disabler. Now, again, we can have conversations offline and in the coffee breaks about how that is manifesting. I would flag to you that we have our new secretariat, the person heading that up, who's our programme manager, Emily Veriker, who I think is in the room, but she certainly is around the room. So she's available for conversations. I am, and Teresa Maguire, and the rest of the team, but Teresa Maguire from the Department of Health will be here as well later on. So let's park that for now, but I see it as a positive. But as well as that, the department only today, so anyone who's been keeping an eye on Twitter, it was press released in the last hour or two that the Department of Health is about to embark on an overhaul of research ethics in Ireland. So they're over the next few months, will be preparing and introducing a research ethics bill. Now, this bill is going to be separate completely from the Health Information and Patient Safety Bill, the HIPS bill that, as we all know, got stuck in the sand. And it proposes a centralised national research ethics committee system for clinical research with medicinal products, which will also incorporate in multi-centre trials. It's an important move. I think it's going to lead to much higher levels of efficiency and consistency in ethics committee decisions in the long run. So watch that space. But again, we'll use the coffee breaks maybe for a bit of a conversation about that. The fourth green shoot, I won't say much about, but suffice to say, technology is starting to have an impact. And it's slow, but advances around e-health and advances are continuing to move forward and hopefully start gathering pace towards health identifiers and electronic patient records. Again, it depends where you sit in the system, but there's more of that happening in some places than others. And then genomics is increasingly playing a role as well. And again, we're led to believe that the department are starting to consider the place of genomics and start to consider the development of a national genomics strategy, which will start to develop in 2019 as well. So look, that's all the good stuff that's extraneous to the HRB. I'd like to think that in the midst of all that green shoot activity, the Health Research Board and our community of funded researchers, in other words, you, are playing an even more important role, an ever more influential role in underpinning the performance of the health system by producing good evidence and good knowledge, I suppose, for improvement. As an agency, this is where I probably do a little bit of a sell of the agency. As an agency, we're just past the 3-year mark of a 5-year strategy. So we're just beyond, coming up on 2/3 in. We did a review of our strategy and implementation just before Christmas with our board. I'm happy to report that we're delivering what we set out to do, and we're continuing to build critical mass in the system. At the end of last year, our portfolio of active awards, so awards that are still running with funding to flow through them, in total is hitting 352 million, which is a really staggering number when you add it all up. And last year alone, we were responsible for over 80 million euros worth of funding pushed into the system, of which about just over 20 million was co-funding through partnerships that we have with the charity sector and other funders, national and international. And this was reflective of nearly 160 awards, 14 organisations, and leveraged then for European Horizon 2020 wins of about 12.5 million. What does that mean? I think the most important thing of all is it means there's talent being developed in the system. So researcher numbers, when we do what we call an end of award return for a 2-year period, or 18 months to 2-year period, the last one of those we did, we had numbers of about 300, just over 300 research posts, over 100 postdoc posts, and nearly 100 PhDs. And that's a number that is there, and it's a number that's starting to grow as well and percolate into the system. And I think everybody is aware of the investment that we put into clinical research, and of course, highly relevant to the National Research Ethics Committee, which I've just spoken about. But over the last 10 years or so, we've put over 150 million in to the system, funding projects and funding infrastructure. And in last year, that has led to over 300 trials in the HRB-funded clinical research facilities, coming up on 12,000 patients on trials, cumulative number building all the time, and coming up just over 3,500 patients on clinical studies in cancer, in the cancer area. And that's only the funding. So HRB also does other stuff. Very importantly, away from the research funding part of the organisation, we also manage health data. So we curate tens of thousands of patient records across certain disease, health and social care areas. For example, alcohol and drug treatment, physical disability, intellectual disability, and psychiatric inpatient treatment. We house the databases for those in HRB. And these data are accessible to researchers to do research with, which then leads to and informs policy improvements and improvements in the system. And we also do research within the Health Research Board. So we conduct and commission our own research through the HRB Evidence Centre, which basically contributes secondary data analysis and evidence reviews to support the Department of Health, to support improvements in the system. We produced about just over 60 reports in the last 8 or 9 years, and many of these reports and these products have resulted in actions and deliverables that sit in Sláinte Care, that sit in Healthy Ireland, and that sit in other national strategies. So I hope you see there's a kind of a joined upness that's starting to come into the system by doing this activity. So look, that's the push done. Stop talking about us now. I know I've been highly optimistic in my terminology. I mean, the system certainly needs a fair bit more fixing. However, there's a way of looking at it being negative, there's a way of looking at it being positive. And I genuinely believe we need to be optimistic. And given that backdrop, we've developed this year's conference around health research, what Ireland needs next. The conference is going to have a design thinking innovation sprint type of format, which I think you've probably read about in the email that's been sent out at the start of the week. We've gathered a real excellent array of international and national speakers and facilitators. As I said before, we're nearly 2/3 of the way through our current strategic cycle. And already we're preparing for the next strategy. The next strategy will be 2021 to 2025. There'll be lots of activity over the next 18 months in starting to engage the community on that. But our intention is that this conference is really the first foray into that engagement. And we've designed it in a way, I suppose, that we're trying to harness the creative skills in the room. So today and tomorrow we want you at your tables to use the innate and natural creativity that you have to address some health challenges that I suppose we've carefully put together, and we've tried to pull real life challenges to those tables, and to develop potential health research oriented solutions to those challenges, and then actually start to draw them up as some tangible concepts. So we've developed 12. They're scattered across, I think, 14 or 15 tables. You can see they're everything from the things you'd expect, the usual suspects: better use of data and health, aging population, addiction, disability, and so on. But there's a few other left-of-field challenges in there, and those left-of-field challenges would include things like lack of trust in the health system. So what role can health research play in that? Think about it. Environmental changes, so with climate change and other issues that will eventually potentially lead to health difficulties for Ireland. So these health challenges look on paper, at first glance they look simple, hopefully they're reasonably easy to understand, but they're multifaceted, they've hidden depth, and each table is just going to be working on one challenge and using the design thinking skills that you'll be learning through the day to try and address those challenges. So, I'm probably way over time, but to conclude, this conference, as I'm sure you've seen by the tablecloths, it's going to be different. We're using different methodologies, and one could ask the question, well, why have you moved away from the traditional? Why do it this way? To be very frank, it would be very easy for us to come and present to you, and it would be very easy for us to come and say, we have a new strategy coming up, tell us what to do. But from experience, we believe that these approaches really are kind of blunt instruments. We know after those kind of engagements that it's difficult to see the woods from the trees. It's difficult, I suppose, to decipher valuable insights from such a diverse range of views and opinions. So the sessions we've designed, hopefully we're going to find better insights, higher quality ideas, and we're going to do it in a creative, graphic, and hopefully fun way. So fringe benefits, you're all working on tables, hopefully with people that you wouldn't ordinarily work with. So there's a bit of diversity there. We're helping everybody in the room to develop new skills around innovation and around design thinking. We're also hopefully addressing challenges that we hear day to day, and we hear a certain narrative on, but addressing them in a different way, a radically different way. And as I said, hopefully having some fun as well.